Government has developed a new approach to tracking and tracing COVID-19 patients. Health Minister Zweli Mkhize announced the launch of COVID Connect. The WhatsApp contact platform went live last month and is said to have yielded many positive results already. Gaurang Tana from the National Health Department joins us now to tell us more about the COVID Connect. Thank you very much for your time this afternoon. So when the platform was initially launched in around mid-March, there were some limited functions. You could receive valuable information about testing, symptoms, isolation, treatment and the like. But now the functionality has been extended. Tell us some more.
Good afternoon, and good afternoon to your viewers. Yes, that's correct. So when the WhatsApp line was introduced mid-March, you could get the latest information, news, prevention tips, wellness advice, etc. We introduced screening, risk assessments a month later, and most recently, we want to support the public in not having to wait for results and spread the virus without knowing it. Time is of essence and convenience is of importance. So anybody who goes in for a test must ensure that they provide a valid cell number, date of birth and address. And we then notify the person's testing with the SMS once the lab results are available. The SMS directs them to a WhatsApp line, 08204685553, and this WhatsApp line would offer them their lab results, provide support to them to self-monitor, as well as give them the ability to report contacts anonymously. And each of these contacts are then sent SMS messages to offer the same support through the monitoring process.
So if I had been in contact with someone who had then subsequently tested positive, I would receive a WhatsApp saying, you have possibly been in contact with somebody who has tested positive. These are the protocols for going to test should I have symptoms, etc. Is that correct?
Absolutely correct, yes. So the person who's tested and confirmed positive must notify that they've come in contact with you. So it's reported contacts. And the system would then take those contacts and anonymously notify the persons that have been exposed to COVID-19.
And no doubt that extended functionality will enable the department to perform these tracking and tracing functions much more quickly and free up personnel. We know that health and community workers who have been undertaking this vast amount of tracking and tracing have been severely under pressure as we see a massive surge, especially in Gauteng. So are you expecting the extended functionality to have measurable results on the numbers of positive cases we're seeing at the moment?
Yeah, absolutely. So contact tracing is a process it's a very important process to suppress the pandemic. And when numbers, humans are always better, but as you mentioned, when numbers get large, they becomes an onerous exercise. And we think that the system is designed to ensure that it's able to take a burden of our healthcare workers. But more importantly, the healthcare workers are then able to use their self-reported symptoms to try and take targeted actions and support those that are in most need.
So it seems quite simple in today's advanced technological world. Why has it taken so long to set this whole process in motion? I understand there are some legal technicalities.
Yeah, there were legal, but there were also technological issues. So what the system does is it not only offer lab results to those testing in public facilities, but also those testing in private labs. And so what the system does is it firstly collates lab results from public and private laboratories, then pushes out SMS notifications to the person's testing, expects reporting back, feed it into the central database, and then make it available to the healthcare workers. It's the end-to-end flow that took time, but we're fairly confident with the system right now, and certainly it's in time to manage the pandemic. And certainly a time that we had to, so when the numbers were low, this wasn't necessarily a problem. The healthcare workers were coping. But when the numbers have increased tremendously, this is certainly a relief to the healthcare workers and the tracing teams.
One of the things we're seeing at the moment, as we see a vast surge in numbers of positive cases, is that the backlog in testing is increasing, and people are having to wait a lengthy time for test results. Is COVID Connect likely to decrease the waiting time for test results?
Yeah, we certainly think so. So previously, a person testing either in the public or a private lab would either be called by a doctor if they had time, or be called by a nurse if the nurse had time. In the public sector, often this was reliant on the person coming back to our hospitals or clinic to fetch their results. This is certainly going to reduce their turnaround time for the person to know their status.
There's so much information about COVID-19 out in the public sphere at the moment. A lot of people are feeling very anxious. You, as the department, are encouraging all South Africans to interact with COVID Connect specifically as a source for information. But how are you able to see in real time how many South Africans are interacting with COVID Connect in order to see whether you need to up your levels of communication in terms of notifying South Africans about these advanced functionalities?
Yeah, so we do track the number of active users. Currently on the COVID Connect, we've got just over 7.5 million users. The system has sent out, from the onset in March, around 355 million messages. So yeah, we're able to track this. Just to share some numbers with you with respect to screenings, more than 1.3 million users have screened, and more than 2.5 million screens have been completed to date.
All right, fantastic. Thank you very much for your time this afternoon. That was Mr. Gaurang Tana from the National Health Department telling us about the extended functionalities of the COVID Connect app, and that's available exclusively on WhatsApp.